So I'm going to go ahead and start our session, I guess. Well, welcome everyone. This is Family and Community Support and Services Lunch Discussion Session. I'm Jiwon Lee, and I am hosting with Claire and Cheryl. And I'm gonna go ahead and introduce myself, and then maybe all of us can introduce. And I know this is, it doesn't need to be structured discussion, but we came up with few discussion points. So I can share with you guys about our discussion point in a little bit. Excuse me, how do I advance my slide? Let's see. There you go.
Have you already shared screen?
Yes, can you see the screen?
I do not.
You do not.
Oh,
Interesting.
I see it fine.
See it too.
I see people.
Maybe you can minimize minimize those screenshots. I don't know, what do you call it?
I have the gallery now. Now I see you.
Out of the gallery view, maybe out of the gallery view will come up, let you see the screen.
I just see you now.
Oh.
On the top,
Odd.
it says view options on the top, and you could pull it down and you could see side-by-side mode, and it should allow you to see the speaker and the presentation.
Side by side?
Side-by-side mode. Under view options on the top.
All right, now I'm seeing 3 people, the speakers.
Okay.
Yeah,
That's
yay!
Can you see the PowerPoint as well?
Yes.
Well, is this the PowerPoint?
With
Yes,
the speakers, yes.
3 people on the screen,
Okay.
yes.
Yeah.
That's awesome. We don't have a lot of PowerPoint content for sure, but just wanted to share with everyone. Yeah, so I am a clinical assistant professor at Georgia State University. I am a nurse. I have a child with a developmental disability who's 11, going to be 12. And my journey started having her and raising her with different developmental challenges, and all these challenges go through as a mother. And I teach nursing students here at Georgia State, but I also do a research, and my research focus is in maternal stress and impaired sleep, how those stress and impaired sleep affects on health outcomes in mothers of children with diverse developmental disabilities. So I engaged in Georgia Land training in 2017, ended in 2017. I'm at Claire, and we do have a co-host, Claire Dees, as well as Sheryl Rhodes. So I'm gonna let them introduce themselves.
Thanks, Jiwon. Claire Dees, I'm the director of Spectrum Autism Support Group. We're based in Gwinnett County, and we serve basically Gwinnett and the surrounding metro area, but actually our reach goes across the state and beyond with some of the resources we provide. We provide support, education, and resources, and part of that includes parent support groups, grandparents groups, sibling groups, dads groups, a group in Spanish only. We meet monthly in Gwinnett County and are open to anyone. We've tried out virtual meetings due to COVID, and they've worked very well, so that makes us a little more accessible to people a little farther away. We provide camps, day camps, overnight camps, family camps. We do social skills groups. We have a drama club, a technology club, a Lego club, all around social engagement and friendship building. We do Saturday respites. We do 2 a month. We also do a lot of family events, and families come from all over for things like fishing days, picnics, pool parties, and we usually have 200 or 300 people come out from all around Metro for those. And it's a great way just to have a judgment-free, safe environment for meeting other families and having fun with your entire family. We also provide community education and training through webinars, and they're on our website, which we'll give that link a little later, for how to do an inclusive church program or camp program, We do a lot of work with local businesses for sensory-friendly events like theater and movies and things like that. So we love sharing that information for no charge with our community to make things accessible and inclusive for our families impacted by autism. We serve about 1,500 families a year and their children, and that probably tells a little bit about Spectrum. Myself, I had a son with autism who did pass away in 2011, but that has impacted and defined my life, and I love supporting and encouraging families, and so I'm excited to be a part of this with you all today.
Cool.
I'll go ahead and introduce myself. I'm Sheryl Rhodes. Probably know or maybe have spoken with some of you over the years. I've been active in the disability community for a long time. Currently Director of Care Coordination at Marcus Autism Center, which is our family support services program. We work with all families who have children who come to Marcus for treatment programs, research programs, diagnostic evaluations, specifically provide referrals to those families, work to make sure that Marcus has a lot of resources for families. We've also tried to address the recent and still active COVID-19 pandemic, providing more resources and information that are about topics that families are interested in that may not have been things we had addressed before, but that impacted families raising a child with autism. Personally, I'll say I'm also a parent. I have a young adult whose daughter. I have 3 children. My middle daughter has developmental disabilities and epilepsy, and has been involved in many different special education programs for many years. And I will put in a shameless plug for Claire. Not only is she a dear friend, but I cannot imagine our Georgia autism community without Spectrum. What Spectrum does is just invaluable for our families. We do a teeny bit at Marcus, I think, but dovetail and always try to coordinate and support each other. So we also have a resource room. We have information for families that we give to everybody about summer camp programs. We run a summer camp program, which unfortunately ours has been canceled for the summer. But we will be able to get back with that in the fall. We also do some co-programming with partners in the community to try to make community programs more accessible. We publish a monthly calendar of community events for families so they know where there are autism-friendly movies and museums. We also will consult with some of those programs that are interested in making their services more accessible to people on the spectrum. And that's been very fulfilling as well. I think I'll stop there so that we can get to answer your questions.
Well, thank you, Claire and Sheryl, for nice introduction. So anyone else want to briefly just introduce yourself?
I'm Siddell Nelson. I live in Morganton above Blue Ridge, Georgia, and I work with a lead teacher for North Star, and we have several students that are on the autism spectrum. So we're always looking for ways to be able to communicate with them and help them to achieve what they need to achieve.
Thank you.
True. I work with the Department of Behavioral Health and Developmental Disabilities, the Office of Transition Services, and my responsibility primarily is placing individuals who are IDD out of hospitals into the communities.
Nice.
It's good to be here.
Welcome.
Hi, I just wanted to say hello. This is Jennifer Singh.
Hi, Jennifer.
Hey, Sheryl. I'm associate professor at Georgia Tech and study health inequalities, focusing on autism service disparities in Georgia. And I just also want to make a plug, especially in this community. I got funding to develop a visualization and tool for sort of mapping out different services that are available in Georgia around autism. And so I lost my screen, so I can't see anyone. I don't know what happened. Am I still there?
Yes.
Okay. And so that's something I'm learning a lot about, and we'll probably be contacting some of you to participate because I need your input because you are the experts.
Hi, I'm Alicia Smith. I'm a practice administrator for a pediatric practice. We became interested years ago before I was doing this, but I'm involved with our local autism support group, mainly as a source of helping our parents and our patients. And one of the doctors I work for will be head of the Georgia AAP come this summer, and he's really interested also. And the whole practice is very supportive, but we are trying to be a better resource to our patients.
Hi, I'll go ahead. I'm Dana Hoebel. I am with the Emory Autism Center. I'm an educational consultant focusing on the 16 to 22-year-old folks and some young adults.
Hi, I'm Amanda Gendreau. I was a special needs preschool teacher in Fulton County for 16 years, and now I'm an instructional coach for the early childhood special education classes, both inclusion classes and self-contained classes. I also do early intervention in Gwinnett County for Georgia Pines, and it's nice to meet everyone.
Good afternoon, everyone. I recently started an internship at Georgia State at the Center of Leadership and Disability. And today I'm going to be the room moderator, and I'm here to participate and help you all with any technical support.
Okay, seems like everyone introduced themselves. Yeah, again, this is not structured discussion, but I, along with Sheryl and Claire, maybe wanted to discuss about some of the existing family and community support for specifically for children with autism and greater community with developmental disabilities. And as many of you probably know about Autism Plan for Georgia, they came up with this quality indicators so that, you know, we can reflect of you know, where we are in terms of family support and community support. So I just kind of came up and copied those quality indicator statements here, but we're going to go probably one by one and open a discussion regarding all these components under family and community support. So we know that you know, we do have, especially Metro Atlanta area and state of Georgia, we do have some formal support for families of children with autism. And I listed help with Claire and Sheryl's input. So many of you probably know Marcus Autism Center, Emory Autism Center, and some of you are working there are here today, and Autism Speaks, and Georgia Department of Public Behavioral Health and Developmental Disabilities and Public Health. So I'd like to have an open discussion. Any other resources you know of, you want to share with us? Where we are in terms of family support for autism in Georgia? Anyone wants to start talking about. We also have had discussion. We know that we do have community support, such as Claire D is now, she's a director and founder of Spectrum, and she mentioned briefly about the support services she provides to the community, and Parent to Parent of Georgia. And I do know some social media through Facebook, online support group, but you know, those informal support groups through social media is very important, and resources for those families and children with autism. So anyone wants to jump in and share your knowledge about some of the family support, either formal or informal, are welcomed.
I have a question for Claire. I didn't introduce myself before. I'm Susan Ezra. I am a special ed coordinator in Thomasville, Georgia, for the school system, and taught a classroom for children with autism for 11 years. And I have a daughter who's 8 with autism. And I also run a 1 week, or it's going to be 2 week next year, overnight camp in South Georgia for children with disabilities. And Claire, I wondered what you mentioned, that some of your services are available to families outside of the metro Atlanta area. We don't have much down here. What kind of services do you have for people outside of Atlanta?
Okay, yes. So we do have a listserv, which is open to anyone, where people can ask about resources. How do you deal with toilet training issues, behaviors? Parents will share their own stories there. We do have a Facebook page, Spectrum Autism Support Group, where people share information, and we put a lot of resources there. But the biggest thing that people come to from around the state as well as out of state is our overnight camps. We do a week-long overnight at Camp Twin Lakes in Winder, Georgia, usually the last week of June. This year it was canceled due to COVID. We do overnight weekend camps. So kids can come Friday to Sunday and try out an overnight experience. And we do those in the spring and the fall. So the next one will be in October, and that is on our website, that registration. And we do a family camp experience Labor Day weekend. And families come from all across Georgia and even neighboring states for Friday through Monday, Labor Day weekend, with all kinds of amazing activities for families. We provide some childcare services. So during the childcare time, parents can go take a nap. They can take a boat ride or a bike ride, or they can come to our parent sessions where we do parent education sessions, and we have our own little mocktail party where parents can interact and just have time together on Saturday and Sunday. And that is an amazing weekend. So those are things that are available for people across the state. When you mention where you are in Georgia, we also this year started a program with Department of Public Health to help expand our model across the state. So we are doing 4 pilots this year, one down in Grady County, which is south of you even, one in Dalton, Georgia, Columbus, Georgia, and Statesboro, Georgia. And if these pilots go well, it's kind of an awkward year with COVID to be able to start new programs, but we'll help people start a support group, a social skills group, a respite program, or a camp program, or any combination of those with a lot of free curriculum and training. So we will be repeating that pilot hopefully again next year. So even if you already have an existing program and maybe you want to expand that, you should shoot me an email after this, because we will be taking applications in the fall for next year's pilot.
Okay, awesome. Thank you.
You're welcome.
Hello.
Hello.
Okay, hi, how are you? My name is Musa Sisse. I'm a parent of a 5-year-old on the autism spectrum. And I think I've been to a couple programs that Claire Dees has done before. My problem with the support programs is the fact that there's lack of support programs for working parents. Because much of the programs, even the parent-to-parent Georgia, much of the activities are during the day. And not all kids who are on the spectrum have parents at home. And so sometimes you have to just look up, obviously I think out of the box in terms of looking for support for myself and my family, but what is there for those families working parents who have
You're
kids.
talking about for your child, Musu?
Yeah, not only for myself, but there are other, working parents who actually go through the same thing in terms of for the support systems. Much of them are during the day. Like for the parent-to-parent Georgia, some of the activities even through Gwinnett County, they're all during the day. And so I, for one, cannot leave work to go to some of those programs.
I will say that Parent to Parent does have a lot of recorded archive webinars on some great topics that a lot of people aren't aware of that you can find on their website. Things like how to apply for the Katie Beckett waiver or special needs trust, those kind of things, guardianship. Our Spectrum meetings we hold in the evenings because we want to be able to involve the entire family. So ours are held the first Thursday night of each month, and we have childcare provided, social skills groups for the kids, sibling group, something for everyone so the entire family can come, and that is to support families that work. I know our camp schedule makes it challenging because it's 9:30 to 3, and that doesn't cover a full work day for most parents in the summer. And then we do our social skills groups on the evenings during the school year, Monday and Tuesday nights. So we are trying to be more thoughtful about people who work and how to include people. And then we do events on Saturdays. All our family events are on Saturdays on the weekend so that hopefully people are available on the weekend. We have a great Mom's Day out coming up August 22nd, which is a great time for moms to get together and just have a day for moms, not about autism, but about you. So I'll always encourage parents to think about what you need for yourself too, not just for your child.
Musu, have you tried to access like the Family Support Services waiver or anything like that?
No, I mean, we have insurance that is able to take care of our son, so we're grateful for that. That is not
right. Well, the
just,
family support. Oh, I'm sorry, I talked over you. Go ahead.
It's just obviously, I mean, for us, one of the challenges we faced was looking for daycare for our son last summer. It was a headache because daycares do not want a child they cannot talk to. I mean,
right.
He's limited in speech. I mean, he's talking well now, but I think that was the most frustrating thing. And obviously I contacted Claire last summer because we were looking for camp for a son, but then it was only ending at 3:30 and I commute into the city and back. That just doesn't work. And so I feel like there's a gap, and we limited, well, no daycares wanting to take a child on the spectrum. There's so many other families who are in our position, who have to choose between economic stability and caring for their child. And I think it's just unfortunate that the current child, daycare center laws, they can just tell you, well, we don't think your child can thrive here, so we don't think this is the best place. Without even, as soon as they hear the word autism, they run for the hills. And I think for me, I think that's the problem, not having options.
I do know that a lot of our parks and rec across the state don't discriminate by disability, and they do accept children with disabilities. And sometimes they even provide a one-on-one if you disclose there's a need for that. I know in Gwinnett County, all camp locations take individuals with disability. City of Roswell Parks and Rec is doing a great job with their camps. Spectrum's camp director actually runs that one as well. So Parks and Rec, their schedule is around working parents. They have before care, after care. So that's one you might check into to see what might be closer for you with Parks and Rec.
I would add also, the same thing is true for the YMCA camps. In fact, they've started really making an effort to have their day camps be more inclusive to the extent possible. We've done some training for their camp staff, and they're really interested in trying to open up their facilities and make them more inclusive.
And
it's good to know. I would never have thought those places will offer that, but it's good to know that.
As a part of Spectrum's Community Inclusion Project, we do go out and train camps, and we do train our local Y every year, and we train Parks and Rec in our community. So even in another area, if you have a program that needs training, we're available to provide that too.
Oh, Claire, I also just wanted to follow up on the other question that it's intentional that Spectrum support group meetings are in the evenings. For the mom who was saying that most things are during the day.
Right.
And
yes, and we have the social skills group meeting during our meeting. So if a family would like to get a free social skills group once a month for their child, they're divided by age and ability for social skills group.
we have a support group now for Spanish-speaking families that's during the day, but for the last 2 months we've tried doing it over WebEx, which is very similar to Zoom. And based on that interest and success, we're thinking about continuing that and offering other programs. Sometimes it's easier, especially if you're a working parent, even just to take a lunch hour or a few minutes to join in with something versus going to. I know how hard it is just to get across town, let alone to come to a meeting in our city. So I think that we're going to see more and more of that too, of groups using this kind of technology like we're using now for all kinds of other training programs, social support, video, access to video training, things like that.
I love that, Cheryl, that y'all are going to be doing that. I really feel like this situation has opened our eyes to how much more accessible it can be for families who have trouble getting out, transportation issues, things like that. We have adult social groups, and they've all met virtually, and it's gone very well. Our Hispanic group that's in Spanish only have asked, can we meet through the summer? Because we usually take the summer off. So we're going to do that. And I'm thinking, oh, maybe we should do that for our regular meeting, if that makes it more frequent and more available for families. So thank you for all your comments, Musu, because I think we need to be aware of how to reach as many people. I think resources are the most important things for families to have access to. So for all the professionals on the call, I'm excited to see you here because that's what parents want to know is who do we call? Where do we go? How do we get in a support group or a camp, and where are they? How do you find that information, right? So the more you know to share with families, what a great support for them.
Cheryl, I have, excuse me, sorry. Can you hear me okay? Cheryl, I have a question actually about, you mentioned about now in camp waivers for support and services, and can you explain it to me or in others who do not know about this?
Okay, so it's now in COMP, and that's actually an acronym for a Medicaid waiver that's available for individuals with intellectual disabilities and related conditions, including autism. It is through the state of Georgia, but what those letters stand for is the new options waiver and a comprehensive waiver. So what this is really intended for is for individuals who will continue to need support, and then of course funding for services as they leave high school and try to either get into work situations or supported day programs and such. It'll help cover therapies, respite care. I'll ask Claire to chime in a minute to make sure that I cover everything. And then the comprehensive is also what a family can use if an individual is going to need supported living situations as well. You have options to get a budget based on your child's need that a parent or a family can self-direct, or you can contract and work with an agency who can help bundle together and put together the services and resources that your individual needs. The biggest benefit of it is
pretty clear, because once an individual is accepted, as long as they continue to meet criteria, they can continue to have this funding for many years. On the other hand, there are, I was on a different webinar, like over 6,000 people on the wait list now for this service. Every year when the Georgia legislature meets, those of us who are interested, in what's happening with the budget for the state are always keenly aware that there are only very few waivers given out. So it's a long, long process. And so we've started encouraging families who think that they are going to need this for their young adult to start no later than maybe age 14 or 15 to at least make contacts with the state, fill out the preliminary application, which is not very long or complicated, and get on a wait list, so that if the situation changes and they need those services and support sooner, they can get it, or that they might come up on the wait list by the time they actually do need it.
Yeah, and so Sheryl, your daughter and my son both had comp waivers to support their needs. I know that in Georgia, because of the funding issues right now, they're focusing on transition age individuals that have finished school. But if someone has a parent who is terminally ill or passed away, or very challenging behaviors, there are some criteria that might move someone up on that list if they were an adolescent. And so I encourage everyone to go ahead and apply and get on that waiting list. You can do that at dbhdd.ga.gov. There's a link there for family support as well. Everyone at this point, if you haven't applied for family support and you're a parent, you need to apply for it, because that's the first thing they're going to ask when you apply for a waiver is, have you used family support funding? Have you used the respite funding? And that funding is available by region, so you can find that information at the DBHDD website, who your region is based on where you live, and then who handles that in your region so that you can apply. Family support is typically up to $3,000 a year that you can use for camps, you can use for swim lessons, you can use for things your insurance doesn't cover. So it's a great resource to have, and it's not too bad of a process to apply. And once you're in the system, you can renew it each year. If someone can show their need is higher, people can get more than $3,000 a year. So it's a great way to figure out how to fund some of these extra things that you need. In-home respite can be covered by family support, but there's also respite funding as well. And a lot of families that are very savvy learn how to maximize all those dollars to meet some of your needs, especially when you talk about having a younger child. I know for me, when my child was around 5, the school kept sending home this flyer about respite, and I'm like, I can never let anybody else keep him. I didn't trust anybody else. I thought only we could do it. And he was nonverbal, and he had a lot of behaviors, and they kept sending that flyer home every month, and they say, did you check into the respite yet? And I'm like, no, I think I'd have to know the person, And then I found that there was a person who did respite that had been one of his preschool teachers that I knew him. And I was like, oh, maybe we could try her. So we did start trying it out. And it was amazing the difference that made for our family, our other children, our marriage, just to be able to have someone come twice a month, even for 4 or 5 hours, to give us a break, who we could trust with him. At some point we got where we could take that person even on vacation with us and enjoy our vacations more. And we just learned how much difference it made for us as a family to use respite. So I always encourage people, if you feel more comfortable in a group setting than having someone come in your home, there are group respites. A lot of churches in our community, they do free respite. That there's no charge even, so you don't even have to use respite funding. And in our community, we have so many of them going now that families can find one a week almost to go to in a nice church, caring, loving environment where there are a lot of people that are all background checked and they've had training. We do a lot of training for respite programs. And so I encourage you, if you haven't used respite or family support, to definitely check that out. You too, Jiwan.
That's right. I mean, even my daughter is almost 12, and when I heard about respite funding and now in comp waivers, and I was blowing my mind. I mean, I should have known already. So my question to you and everyone in this room is, how can we, um, I know, you go to the different website and you are, web savvy and you are motivated to do so. You can find some information, right? And as a parent, I mean, when I was thinking back, raising my child when she was 4 and 5, we had so many issues with medical issues and dealing with my work and her daycare versus school and therapies, and there's so many competing priorities. And I know that I want you to know more about these resources, and unless you really need one right away, like Katie Beckett, I mean, you got to know and apply. And having an insurance, having the developmental disability expert and specialty doctors, but then I don't know, how do we, I see more needs. We need to train healthcare providers perhaps, because many doctors and nurses at the clinic, like specialty clinic, I don't think they know and aware of all these resources.
Mhm.
And other than, you go to the daycare, you go to the school system. Once you are in the school system, teachers and actually are a great resource for the family. And, they share with us, this is you need to go, this is you need to apply. Until you get into the school system, especially like 3, 4, 5, 6 years old, I think most oftentimes you probably see different doctors and pediatrician. So I think they need to be trained and more aware of resources for the family and community. So from this conversation from now on, as a nurse, I'm a nurse and teaching nursing students, and think about, how can we connect and teach not only the parents, but then, the healthcare providers, nurses, and doctors. And unless you go to the Autism Center, Marcus Autism Center or Emory Clinic, or very specialized developmental clinic, I mean, rural Georgia, I mean, it's just, so that's something I probably want you to pursue and dig down, try to find more about this. And thank you so much for this thoughtful and intriguing discussion.
Yeah. And again, another plug for the support groups or Claire's listserv, Spectrum's listserv, I should say, is that's the way a lot of families get information, is through other parents. If you've never heard of something and somebody else does, or they tell you they have respite for their child and you say, how did you afford that? And they say, I've got this waiver and here's what you do. It's the way of the world, right? And particularly for these services, not everybody is going to just have either access, as you say, to an autism center, but we all have access to some resources. I just want to share one more as well that I'm not sure if it got listed someplace or not, and that's Autism Speaks has a program called the Autism Resource. What is their actual title? It's their Autism Resource Network, and they have Autism Response Team. I'm sorry, it's the Autism Response Team. The acronym is ART, and they have a network of people, approximately one per state, who is someone who lives in the state, has a child with autism, and can answer many questions that one has. If you go to that page where they have the autism response team, you can see all the lists of questions. You can get information about the toolkits they have, funding. They also have some lists of physicians, programs, both locally, internationally as well. They've also put together, I think, a nice page of resources that are autism related in relation to COVID, and looking at that. A new webinar that just went up, giving them a plug again, but it was with the American Psychological Association and Autism Speaks on research and strategies and providing parent training right now, the things that parents can do at home. So it's just another really good resource. And especially if you can't get out to go to meetings, figure out a way through one of these online resources to connect with other parents.
The other thing, Cheryl, about Autism Speaks is they have amazing toolkits. There are resources of toolkits for, I mean, how to get your child's haircut, transition, early when you're diagnosed, first, what do I do first? They're also very helpful information in those toolkits.
Yes.
One thing that I just wanted to mention really quick from Jawan, when you were saying training, we're actually doing a program right now through a grant, through the PCORI grant, where we're working with the nursing school at Emory to train nurses to work with people with autism. And we're going to be doing, it's kind of gotten sidelined with everything that's going on, but we actually will have basically like a module that the nurses will go through, and we'll have clients, and so they'll be practicing on both ends. Our individuals with autism will be practicing like advocating for themselves, and then the nurses will learn how to, nursing students will learn how to work effectively with people with autism. So hopefully there's going to be more of that coming along. And one thing that I just wanted to mention on the side is through the Georgia, the crisis line too is really important to have that number, and that's through the Georgia Department of Behavioral Health and Developmental Disabilities. And on their website, I don't know if it's listed here, but if you've got a kiddo that is having like pretty significant behavioral issues and you just need support, they have a number and they will help you. It's a good thing if you need it.
Yeah, the acronym is GCAL, G-C-A-L. It's the Georgia Crisis and Access Line.
Thank you so much for that helpful information. I've never heard of it, and especially that PCORI grant you just talked about. Very interesting. Do you have a website on Emory School of Nursing?
I don't. If we want to connect, if you want to shoot me an email, I can connect you with the person on my team that's doing that work. I'm actually not. It's one of our therapists, but.
Sure, yeah, that's very interesting. Thank you so much, Dana.
Yeah.
There is a very big need for educating pediatric offices. I can tell you just from the fact that my office tries very hard, but an organized approach. There's programs like EPIC, educating physicians in the community, that they do the same programs every year. Something like this would be so beneficial. Teaching our staffs how best to schedule children when they're in the office. It'd be so, we've identified all of these things, but not in an organized way to teach not just my staff, but other staff. And I've reached out to other practice managers across the state, and even nationally. There's a disconnect, it seems to be, and there shouldn't be. It's like, okay, we have a family, and it's better than it was 20 years ago when I came here, and it's better than it was 10 years ago, but it needs to be better still. It needs to be better faster, in my opinion. So I'm really happy to hear there's something for training the nurses. I'm always looking for any kind of educational things, especially now too. We're working and we're filling in time, and we're trying to do it through in-services and education. But we want it to be the right information, and we want to empower them to help our children. So I thank you for that information.
We have nursing students that volunteer with a lot of our camp programs, and part of it's their clinical hours, and I think it's very valuable experience for them, and it's a help for us as well to have them, especially during overnight camp with all the medication sorting and administration and that kind of thing, but just for them to see, individuals right up close. I say always, though, that parents learn more from one another than they do from any professional. But we do have some professionals that know a lot of great, Dr. Leslie Rubin's amazing. He shares great resources. with his families. I get a lot of calls where they were referred by him. But most physicians, like you say, they don't even know the resources. Right now, we have all these ABA clinics coming into Georgia, and they have figured out how to market and compete, and they are hitting up the local physicians and letting them know, hey, you can recommend this and we can provide the service. And I'm thinking, if they could only just give all the resources while they're there, not just theirs.
Well, it's also educating the families to know to ask their pediatrician, because the one way we've gotten better is by parents coming to us and us saying, I don't know, but I'll find out. And that's what led us to this support group in our county. And quite frankly, I learned more from those women who are parents who are involved than I've learned from any educational thing in the medical, pediatric community, or even as a practice manager, but even things my doctors have shared with me. And they're good doctors. I mean, they're excellent. So I can imagine some that aren't focused on this, the patients are missing out.
Yeah.
So we need to do a better job.
Do y'all have any other ideas or solutions of how we can get information to these pediatricians? Because it seems like that's kind of a core spot where people are going to go on a regular basis, and those doctors know people need support, they need services, they just don't know where to refer people.
Yeah, several years ago, the Georgia chapter of the AAP, American Academy of Pediatrics, did do it was a one-day workshop. Claire, do you remember that? They did it 2 years in a row, and it was for pediatricians, and there were some office managers there and nurse practitioners. The focus was more on healthcare transition, and then also some emphasis also on just patient management for kids who were on the spectrum. But the focus was on healthcare transitions for pediatric practices for their patients who had autism. I guess you could always contact them again. It was their educational outreach specialist who organized it, Fozia.
Fozia, yeah.
Yeah.
I'm familiar with them too.
Yeah,
But it's just also the idea of bringing it into, it's wonderful to educate nursing students, and it's another thing to educate the ones who've been practicing or working for 20 years, to prove we can teach old dogs new tricks.
This is a topic that we should probably address with the Autism Plan for Georgia, Cheryl, as one of because we have a great group of partners there that have this kind of reach. So I'm glad this topic is coming up today so we can pass that along. Susan?
Yeah, it's great. Dental offices as well. Dentists and dental offices. So initially when we started our journey, we got charged for behavioral management by dentists. Every time we go in there, we had to stop and then started looking around for dentists, and I could not find a dentist initially to really treat my child, because some of them do not know what to do, and they will charge you if the child is not, it's not cooperating with them.
Right. Have you found a dentist for your child?
Yes. So we go now to Dentistry in Beaufort, Children's Dentistry, Beaufort, and they've been really great. Obviously, it's not been an easy journey. I mean, I dread going to the dentist, but it's better. We don't get a management fee. And after that experience, every time I did call quite a bit of dentist offices around before finally settling with them and asking them, are you going to charge me because my child has autism? And they said, no, we do not charge you. And after the first year, I got reassured that they will not charge me, because my previous dentist was charging us almost $180 for behavioral management because, the child was not cooperative. And so,
Yeah. There's also, if anybody else needs this resource, the dental.
It's Dentistry for the. It's called Dentistry for the Developmentally Disabled, DDD Foundation. And if a child needs to be sedated, they can do that there in the office, which is helpful for some children or adults. I see children and adults.
Yes, and they're wonderful. So DDD Foundation, And they're in Atlanta as a really good resource.
Excellent. I have a question. Siddell here. And I think one of our barriers is not in my classroom, but for students that have graduated, and I still keep in touch with them. They are not only bullied in life, but they can't get the resources they need because of the fears that they have. And I'm trying to get information that I can hand off to them so that they can go on with their life. And one of those things, I guess, would be if I had a piece of paper with information on it that I could just hand to them. But I'm not sure how to go about getting a list of these things unless I were to, I can write down everything that you've all said and try to go to those websites and maybe make a document, I suppose.
So are you talking about something that you or your individual could give to somebody when they're in a certain situation where
yes,
there's a problem?
Even in class, if I have students in class, they don't know where to get help. The parents don't know where to get help. And I'm in North Georgia. I'm like on the border of Tennessee. And I have students that have already graduated and are on the scales higher or lower in autism. And there are many, and they cannot get the services that they need.
So are you thinking that you would just want to put something together then that would give them a parents number, the Autism Spectrum, things
Yes.
like that? Yeah. I mean, I think that would be a great thing if you could.
Yeah. And I have just learned so much today, right now.
I'm so glad to hear that. Siddell, am I pronouncing your name correct?
Yes, Siddell. They call me Sid for short.
Are you in the school system? I forgot your introduction.
Yes.
School system.
I'm a parapro for North Star. We are a program that serves EBD, and a lot more of our students are on the autism spectrum, and we are trying to learn as much as possible.
Okay. Well, thank you for sharing.
Another resource for your individuals would be Georgia Vocational Rehab too, where they might
We
get
do have them.
connect.
We finally got them.
Very good.
And then did you say that there were some individuals who were higher functioning and maybe wanting to find out about schools? Because there are, if you aren't aware, about 8 higher institutions, colleges and universities in Georgia that all have, they're not all degree programs, they're certificate programs, but college level coursework for individuals with autism and related disabilities.
Those we're familiar with, and we do have a few of our graduated students that have gone on into writing. Fantastic stuff they're doing. So we do have that, but it's some of the other stuff that we are lacking in up here in Blue Ridge.
Yeah, a lot of, I hear, so we're in 103, so we have about 5 minutes or so. So I hear a lot of consensus on still need, although these resources available, seems like many of them are concentrated in metro area, and we still need more resources in rural Georgia. Claire mentioned a couple of project is going, but still we definitely need more resources. I mean, so I see a lot of, most of us have agreement that these resources written down and needs to be shared amongst us, amongst the parents, and certainly with healthcare professions, doctors and nurses, pediatric offices, and they need to be trained. So these are all very valuable and helpful discussion points and information. So I will certainly summarize these and deliver back to Center for Leadership and Disability and colleagues interested in improving community support in autism in Georgia. So yeah, this is very helpful and informative. I've learned a lot too. I should have known more, but that's for sure.
I love it.
Yes, yes. And are you guys engaged in any social support group?
From the school?
I guess as a provider, as an educator, as a health.
Yes, we have daily meetups with our students. Even though we have the school year has ended for most of our students who have already passed their subjects, and it ended probably, I guess it was Wednesday of last week, where our students have already graduated or passed onto the next grade. We only have 2 that are outstanding, and we're still trying to, here you go. There's the class, and they have their computers at home and everything, but we also have meetings. They can come to the meetings at 10:30 and 2 o'clock so that they have emotional support.
That's good to know, good to hear. Thank you for sharing.
I'm actually a board member of the Rockdale County Autism Support Group, but I'm the least. I tell everybody I'm here to learn. And
we all are.
It's an excellent, excellent group, and the women involved with this group are my heroes.
This has been awesome.
So.
Any final remarks and any final comments before we end this discussion table?
Juwan, did you share our email addresses if anybody wanted to contact us after this?
No, I haven't. I'm sorry. Well, I haven't. Maybe you can share, Claire.
Okay, and maybe Yazi will get it in the chat box. Mine is Claire, CLAIRE @ATL-spectrum.com, and anyone can contact me anytime about any questions, issues, resources. That's what I do every day. So I'm available if anybody thinks of something after this or have ideas to share.
Thank you all. This has been great.
Put our email address in here. I would appreciate any contacts, resources, and sharing of information at any time with anybody.
And my email is my first and last name with a period in between, CHERYL period RHODES @CHOA, CHOA.org.
Thank you so much, Claire and Cheryl, to share your information. You guys can also Google their names, and perhaps their affiliation will pop up, and you can also find their information. I'm at Georgia State, and my email is J as a James, LEE number 242 @gsu.edu.
All right. Thank you.
Thank you, ladies and gentlemen.
Thank
It was a pleasure to meeting with you, and have a great discussion.
Have a great day.
Thank
all.
you.
Thank you. Bye.
Thank you.
Bye-bye.
Bye.
Bye.
Okay.
It was awesome. Thank you once again.